Once again, we are honored to be joined by Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation, also the former acting director of the CDC, the Centers for Disease Control and Prevention. Dr. Besser, great to have you with us.
Thanks so much for having me on, Steve.
Moving target, by the way, you can find Dr. Besser on so many national, regional broadcasts. We're honored to have him with us, and also honored to have the Robert Wood Johnson Foundation support what we're doing in terms of public awareness around critical healthcare issues like this. So, Doctor, let me ask you a question. Our teenage sons were pressing me on this question, and the truth is, they're not the only ones, and I'm not the only one who didn't know the answer. So, Dad, you get the vaccine. Mom gets the vaccine. We get the vaccine. So, you guys will be good, and then we can go back to normal, Dad? We can be with our friends and hang out inside? What's the deal? And I said, I don't know. I asked Dr. Besser. Go ahead. This isn't just for me. It's for millions of others. Go ahead, doctor.
I mean, that's the big question, and that's the eventual goal, is to being able to have your kids' friends in the house, to be able to go out and do everything we want, to get rid of our masks. But it's going to be a gradual stepwise process. And so, yes, when you get vaccinated, after you've had your second dose of the vaccines that are out there, and it's 2 weeks past that, the chances are that you are protected, and that's a wonderful thing. As I talk to people who've been fully vaccinated, their mood is lighter, they feel better. There's just less anxiety in their lives. I would wait and follow the recommendations of public health in terms of how much you can liberalize your life. So getting together with other people who are fully vaccinated, I would expect that that's going to be something that's recommended that you can do. I think that what we're going to see is hospitals and nursing homes are going to let people who are fully vaccinated visit their loved ones. My parents are now, they both received their 2 doses. And so I visit them, I wear a mask, but I feel much better about the whole encounter. So the eventual goal is to get there, but it's not you get the shot and off you go.
This is another real quick one, if I can get 30 seconds or less. If you get the vaccine, whether it's Johnson & Johnson coming online, that's one, if I'm not mistaken.
That's right.
One vaccine, one shot. When we're protected, does that mean you're unlikely to get it and unlikely to give it? Help me on that.
Well, you
can't give it if you don't have it.
Yeah, the first part of that is true. You are unlikely to get it. You're unlikely to get COVID with symptoms, because that's what was studied. They didn't look to see, does the vaccine prevent you from getting an asymptomatic infection? So can it get in your nose, but it just doesn't spread throughout your body? And so that's the critical piece as to why public health people aren't saying, yeah, get your shot and off you go. It hasn't been proven that people who are vaccinated can't spread it to others. It's likely that they either can't spread it or they're much less likely to spread it. But until that question is firmly answered, that's why they're not. You're not hearing recommendations of just get vaccinated and go.
Doctor, I saw you on the Today Show talking about this. I want you to touch on it as well. What does it mean to be an epidemic disease? Could this be an epidemic disease, meaning it's with us for a long time, just mutating and changing?
Yeah, so there's words we use in public health. There's the pandemic, where it's spreading around the globe. There's an epidemic where you see a big rise in one place. And then there's something called an endemic disease. An
endemic, I apologize.
Yeah. An endemic disease is like the flu, where it's here, it's got a seasonal pattern. We kind of know what it does. There are a lot of infections, the rotavirus, the common cold. There are a lot of things that we see that are here, and we've come to live with them. And if they're not too bad, we likely haven't developed vaccines. If they're like the flu, we have. And so COVID could end up being something like the flu, where each year we're needing to get vaccinated because it's mutated and changed enough. And the flu, we get vaccinated against 3 or 4 different strains at once. It's possible that's the situation we could get into with COVID if there's more than one strain causing problems circulating around the globe.
Doctor, when you use the term vaccinated, is that different from you get the 2 or the 1, whatever it is, whether it's Moderna or Pfizer or Johnson & Johnson moving forward, et cetera? The booster, is that the same as a vaccine, or is that in addition to the vaccine?
So different vaccines require different numbers of shots to give you the highest level of protection. So it used to be that, when we were little, if you got one measles shot, one MMR, you were covered for life. And then it was found, wow, it drops down over time. So we now give two. We give one at age 1 and one at age 5. For this vaccine, for the Moderna and the Pfizer, they're both vaccines. The first dose primes your immune system. It gives you some response. And then the second dose really jacks it up, so you've got a much higher level of protection. The J&J vaccine, which the FDA is going to be considering soon for approval, that's one dose and you're done.
What's the booster?
So a booster is just the same vaccine, you're getting it again. And so like the whooping cough, we get a booster shot of pertussis. We get a booster shot for that when we get older. Pregnant women get a booster shot. It's the same thing. For some reason, we call it a booster just to say, well, it's boosting your immune system. It's reminding your immune system of something that it had developed a response to before, but it may have started to fade.
Let me ask you this. So many parents, my wife and I, countless others, kids, school, COVID, does it depend upon when, where, et cetera? What else?
So the CDC put out, I think, some excellent guidance last week on that. And what they're saying is something that we've been saying over the whole last year, is that what's going on in the community really matters in terms of your schools. And so if you're in a community that really has COVID under control to very low levels, you should be able to get most kids back in classroom learning in person. If you have higher levels of transmission, you may be able to get kids back into school, but probably not as many kids as you could if it's at low levels. But what we found over the past year through many, many different studies here in the United States and around the globe is that if you're able to provide schools with the resources they need, so all the children wearing masks, extra staff to be able to do screening and to do cleaning, if you're able to decompress your classroom so that children aren't sitting right next to each other, there's some space between them, and you can check your ventilation systems. If you can do all of those things, you can get kids back into school safely learning.
I'm sorry, Doctor, without teachers, again, the whole question about vaccines for teachers. Let's assume teachers, some are, some aren't vaccinated. Make a difference?
Well, I mean, those studies show that you could do it without vaccination. I think that teachers should be in the group of essential workers who are getting vaccinated. And as supplies go, yeah. I mean, I here in New Jersey, we're vaccinating first responders, but we're not vaccinating people who work in the supermarket. We're not vaccinating people who are driving the bus.
That's as of today, February 16th, but go ahead.
Exactly. And it's going to increase. Those groups are going to be included as the supply goes up, but I think they should be part of who's vaccinated now. I mean, I have the luxury. I can work here from my house. I rarely have to leave the house. And I'm very fortunate in being able to do that.
But many are not. We're not being smug about it, but we're maybe the exception.
Many people have to go to work, have to leave the house in order to put food on the table and pay the rent. And we should be vaccinating those people. They're helping keep society going. They're teaching our children. They're stocking our shelves in our supermarkets. They're producing the food that we eat. They're driving our buses. They should be vaccinated as well.
And by the way, they're also running our camera, like Scarlett, who is here right now. He's in our home doing this. I'm in my home. Just let's be clear. There's a difference. Everyone has a different situation. Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation, also former acting director of the CDC. Cannot thank you enough. Every time you join us, Doctor, we learn important information, accurate information. Thank you, Doctor.
Thank you so much. Be well.
You got it. I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare, NJM Insurance Group, the Healthcare Foundation of New Jersey, Georgian Court University, PNC, Grow Up Great, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, MD Advantage Insurance Company, And by St. Joseph's Health. Promotional support provided by NJ.com. And by ROINJ.
Being a kid is all about playing, laughing, and having fun. Doing what they do best, from rolling in leaves to building a snowman. But when illness or injury slows your little one down, you want the best pediatric care possible. Turn to the experts at the St. Joseph's Children's Hospital to get your superhero feeling super again. St. Joseph's Health, helping kids be kids.